Hey friends, welcome back to Yoga for Dentists. I'm Dr. Josie DeVideo, longtime dentist and certified yoga teacher. Today I'm chatting with Dr. Laura Schwindt, who is in the wonderful state of Oregon. And today we're going to be chatting about the symptoms of burnout and what you can do about it. So Dr. Schwindt, welcome to the show.
Thank you so much for having me. And thank you so much for all you do to bring balance to the world of dentistry.
Thank you. Thank you so much. So I wanted to have you on the show because you and I have gotten to know each other a little bit and we share a similar story. But you're a great storyteller. So I wanted you to come on because I know that for several years you were dealing with burnout, not just in your practice, but probably in life because these things are closely related. And so I know that this is a common problem in dentistry. Sure, it's a common problem, I'm sure, in some of the other high stress jobs like being an attorney and whatnot. But we are quite familiar with the world of dentistry. I personally know a lot of colleagues who have dealt with this and suffered through it, and some who just muscle through it and stay burnout and, live not the greatest life. So I really wanted to have an honest conversation today so that our listeners, our viewers, can know that they're not alone, can get some hints on how to help themselves come out of this burnout, and maybe, start to reevaluate things in their life so that they can live a better life. I mean, what is the point of having this wonderful job and this wonderful lifestyle if we aren't really enjoying it, right? I mean, we're giving up a lot for the sake of having this thing in our life called dentistry. So, what were the first signs of burnout for you?
It's funny how it just sort of crept up on me, and I sort of normalized it, like it was just the normal part of aging. One of the first things that started happening was began to not sleep well at night, and I would wake up and be wide awake, and then my worries would start, and anxiety would take over, and I would not get a restful night of sleep. And you know how that just snowballs to the next day, craving high carb foods, needing coffee to stay awake, and being more irritable. And in talking to other women around my age, I just found out that this was normal and you just had to deal. And so I thought, okay, I guess that's just normal and I have to deal. And then it kind of surfaced as body aches and headaches. And that became, well, you do a very physical job, right? You're
Right.
bent over, you're ergonomically challenging yourself all day, every day. You're concentrating, you're probably squinting. That's maybe where the headaches are coming from. And it just became where I didn't feel myself. And I would go to the doctor and ask, what's wrong? Is there something that I can be doing? Is there something I can change? And I was always met with, this is just sort of how it is.
Right.
And so I started to accept it, like I think so many people do. And that is really probably one of the first things that, looking back, it was my body saying, hello, you're pushing yourself too hard. You're not balancing the stress of your life with the recovery of your life.
Absolutely. And, you've said a couple of things that really hit home for me. I have a very similar story. And, it starts to be like you were saying, is this a normal part of aging? Like, is this hormonal? Is this, you lack of sleep? Because some of these symptoms are like fatigue, like it's like a symptom that's like generic that could happen for a variety of reasons. So we start to blame everything else but the elephant in the room, which is that we have a very high stress job and we're spending a lot of time taking care of other people and not so much time taking care of ourselves. And then we set ourselves up for disaster because we do things like, okay, I didn't sleep very well, so now I'm going to need coffee, which is coffee. Coffee is wonderful and I love it and it has some health benefits. But the more I'm learning about coffee and how caffeine works in our body, it's really just another psychoactive drug that we use to stay alert and to keep going. So it's almost like I joke with people that it's like a socially acceptable, like crystal meth or cocaine. Like we just need it to keep going because we need to function and be sharp that day. But it does take its toll on you. Right. And so, yes, when we're not feeling well, we end up, we don't have time, bandwidth, energy to make healthy food choices. And, Tico's tacos sound really good, and I'm just going to eat those. And I'm not talking like healthy street tacos. I'm talking about deep fried, lots of cheese, and, not good for you tacos. Like hangover food is really what I'm talking about here. So,
Exactly.
but the point is, when we're not feeling well, when we're not sleeping well, everything else just kind of falls off the wagon because it's easy. It is harder to eat healthier when you're not used to it, when you're not mentally prepared for it. So we're setting up a vicious cycle when this happens, right?
Yeah, and it's interesting because when you talk to your colleagues, when you talk to other professionals and medical professionals, it's sort of like the badge. Well, that's how it is. You're a healthcare provider. This is what you signed up for. And so then you start to feel a little bit ashamed, like, well, why can't I deal with this? Like,
Right.
why am I not able to deal with this like my other colleagues? And that's where like the secondary symptoms of burnout start surfacing, that feeling of isolation, the feeling of shame, emotional exhaustion, compassion fatigue, just all those things where you just start to lose your joy in life.
Yes.
And then you're not feeling good. I think you and I talked about the fact that we couldn't digest our food because we were in fight or flight so much that our body wasn't able to digest. We didn't have stomach acid to digest because our body was ready to run away, not sit and digest our food.
Right.
And so you don't feel good. And then you start to not be able to do good. It's just this vicious cycle, and really challenging to voice with other people. You just start to feel like you're the only one.
Right. And that's part of my mission with the Yoga for Dentists. I mean, it sounds like it's only yoga, but it really is a wellness forum for me because there are so many things that we don't talk about in dentistry. We don't talk about physical health of ourselves, mental health, wellness things. I mean, wellness, that's kind of a trigger word for some people. Like they think it has to do with like, wearing linen and sitting in a Zen garden somewhere. But wellness just means taking care of yourself the same way or better than taking care of the other people that we take care of, whether that's people in our family or people in our practice or our staff. So it's funny because I remember one time when my boys were little, I was very health conscious in terms of food for them. And I would always make them super healthy meals. And then I would make myself something really bad. And I tend to only make one meal for the whole family. But, there's some weekends where I'd be like, oh, they're going to eat this and I'm going to eat like, whatever was bad for me that day. And I remember thinking one time, like my husband says something like, just make one thing, because I got into the habit of doing that on the weekends of like stress eating. Just make one thing. Don't make like separate things. I'm like, no, I'm not going to, because I want to eat this and I'm not going to feed this crap to my kids. So it's like, okay, I'm aware enough to know that what I'm eating is bad for my kids,
Right.
but I willingly invite it into my gullet because that's what's going to feel good for me. And I'm so burnt out. I just want to feel good, however that looks. And I agree with you that it becomes like this badge of honor. Like everyone's like, yes, I'm so stressed out and I hate my life. I must be a good doctor, you
Right.
know?
Right.
And it's like, that's the most, like now that I'm outside of it, it's like, that's the most ridiculous thing I've ever heard. Right. Like I remember going to lunch with one of the oral surgeons that I referred to and telling him like I was having all these issues and I was thinking of selling my practice and all that. And he was basically like, what are you talking about? I haven't been able to turn my neck more than this for the last 15 years, like, yeah, you just live with it. And I'm like, that's a terrible way to live life, like there is more to life than dentistry. And I think for a long time, we don't recognize that. because we've spent so much time in our schooling, studying, building up our practice,
Mhm.
reaching our goals, that we forget that dentistry is just a small part of our life. It
Oh,
is not the big picture. And so we can't let it control us in that way.
right. It's like that identity where if we take that identity away, who are we, right? But
Right.
we're so much more of a person. Even, even as a dentist, we have so many other facets to our personality, whether that be we're a mom or a daughter or a sister, or we have hobbies that we love and enjoy. And for so long, we do have to focus on the one thing, the dentistry, because it is so time intensive, the training, the opening a practice, that type of thing. But ultimately, if we think back, we did this so that we could enjoy life.
Right. That's the irony. Yes.
Yeah. Yeah. And so I think that in and of itself is just something we talk about with our kids, and we want for our kids, and we want for our close friends and family. We want them to enjoy life. Well, we should want that for ourselves too.
Right. Yeah. Yeah. We got into dentistry because we could be our own boss. We can make our own hours. We can take vacation when we wanted to, like all these like things we thought were going to happen that could happen
Mhm.
if we stay aware and in tune with ourselves and focused. Right.
Yes.
But
Yes.
sadly, many people don't.
Yeah.
So, what was the breaking point for you? Like, what kind of what was your aha moment?
Well, my aha moment was my son was diagnosed with a genetic disorder that affected his aorta.
Mm,
And when we first found out, we thought he would need open heart surgery right away. The doctor kind of led us to believe that. And then he'd have these lifelong ramifications and things that he needed to really think about for the rest of his life. And that really stopped me in my tracks because I was just really not present with my kids when I got home at night.
right.
I was so wrapped up in the office and the dentistry that a lot of times I was just going through the motions at home.
Right.
And so that was really my breaking point was I need to be able to structure my career so that I can be present for my family. And especially now when we have this potentially life threatening issue. And, I want to live life, I want to be there for them. And so that
Right.
was really the moment where I realized I need to restructure. I need to do something, and it really began with a life coach that she just told me, "You need to get up 15 minutes early just for you." And I remember thinking, "Well, that doesn't seem right." Like I'm wanting to be more present with my family. Why am I taking time for myself? Right?
Mhm.
That felt selfish.
Right. Right.
But yet that was like the tipping point, like, oh, wow, I am really lacking in time for myself. And that is why I'm not able to be present. That is why I'm not able to focus. That is why I'm not able to concentrate and all those other host of things. So it was the little crack of light that was shown to me. And I'm very thankful for it because maybe had that not happened, I might not have looked at it as the same.
It always strikes me that a lot of these things to get us out of this mode are like simple, common sense things,
It's
right?
crazy, isn't it?
But we, for some reason, I don't know if it's like our personality as dentists or what, like we want it to be a complicated, let me jump through the hoops, let me get like 4 or 5 professors to check this off. Like I need like some super hard thing to do. When really it's just someone saying to you, okay, how about if you take a deep breath before this happens? Or how about if you spend some quiet time? Or, are you taking care of yourself? It's like these are things that should be second nature to us,
Mhm.
but they're not, and that's why there are life coaches, and I remember when life coaching first started to be a thing years ago, that people were kind of like, what? This doesn't make any sense. Well, the reason they exist is because we don't know how to do life without them.
Mhm.
Like we need people to tell us to remind us, like, look, okay, you've been doing it on your own for this many years. How's that going for you? Like, you're stressed out, you're burnt out. So get some help, get someone to help guide you and hold you accountable, you know?
Right. Well, and it was such an interesting thought because I'd always had mentors, right? In
Mhm.
dentistry, you always had mentors, and I always had consultants. And so I thought I was covered. I thought,
Right.
um, and then I had my own spiritual life, and so I really felt like I was covered. And yet, when I will never forget my first conversation with my life coach. I got off the phone, and I just was like, "Wow, she listened to me. She really wanted to know about me." And that was just so nice. Like there was no agenda other than to help me uncover me.
Right, right.
And so it was a really eye awakening to me that you spend all this time, effort, money on all these other people in your life to help you succeed. Why not? Why would you not look at your life too?
Absolutely. Yeah. Like, I think about, we spend money on accountants. Like, we could count our own expenses and our own money and our own whatever and make these decisions. But it's like, you know what? I'm going to ask for your advice or your input on what I'm doing because you can look at it objectively, whereas I am enthralled and emotionally attached, right? So it just makes sense that as a dentist, yes, we have all these other coaches, we take CE classes, we're constantly honing our craft. So why wouldn't we invest some of that time, effort, money in getting a consultant, a coach, someone who is trained to help guide you and to look at your life objectively and say, yeah, I know you've been doing this for a long time, so it seems normal to you, but it's not normal, you know? So this is how we can fix this problem.
Mm-hmm. Yeah, I think of you and yoga, for instance. I've done yoga in my house with a video for years. And last year was the very first time I was brave. This was before COVID. I was brave and I went to a yoga studio for the very
Mhm.
first time. And I was amazed because she tweaked just my positions. She helped me with some breathing. There was a neat meditation at the end. Like all this wealth of knowledge that she shared with me that elevated my yoga experience, right?
Right.
So,
Yeah. It's like getting pearls. Like I remember
yeah.
years ago, there used to be a newsletter that would come in my mailbox of like dental pearls. So it's like, I know how to do fillings, but if you can give me a pearl to make it better, I'm like, sweet, sign me up for that. So I would get these newsletters and read them and learn as I went along. Yes, we already know that we need to sleep well, eat healthy, exercise, get fresh air. We know that.
Mhm.
We need the pearls. We need someone who understands our life, someone who understands the stresses to give us pearls so that we can have a better life. And that's why I think it's wonderful that you're doing this. You're a certified life coach. You have specifically created a Facebook group called Reclaim Your Balance to help specifically women in dentistry, women professionals, whether they're dentists or hygienists or any role that women play in the dental profession
Mhm.
to help them, to give them these pearls and help coach them along. So
Mhm.
tell us a little bit more about that and what your mission is.
Yeah, well, my mission is that, I had a chance to explore what happened to me. And by taking some time off and really sitting with these feelings and what had gone on. And what I realized was that if I had started doing just a few simple things early in my career, consistently, that
Right.
I wouldn't have gotten to the point of burnout and I would have felt better. And so that became my mission was I need to share this because if I can help somebody either prevent or get out of or even their friend if they see or a colleague whatever then that is enough for me. That would make my day to know, because that, like I said, it was so isolating. It would have been so nice to just have somebody that was there for you that said, hey, I see this happening to you. I want to help. Right.
Yes.
And so, yeah, it's like you said earlier, these things aren't difficult. They are not complicated, but it's a matter of applying them and being consistent with them, and really caring about yourself to do them on a daily basis. Little tiny things that can add up over time. I like to compare it to like a midlife crisis.
Mm-hmm.
Like, people have midlife crisis maybe because they didn't take time to have fun, you know.
Right.
They worked, and all of a sudden they realize, oh my gosh, I haven't had any fun. Now I'm going to have a midlife crisis, right?
Right.
Well, it's the same with balance, I think. If we do a little bit every day, then we don't get to that point where we're like, I need a sabbatical and a trip around the world and a massage every hour, right?
Right. 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 And a Porsche.
Exactly.
Yeah. Yeah,
So,
absolutely. I mean, it's kind of like, human nature, we have the attention span of a gnat, right? So like, even if we're fully focused, like we can be fully focused at work and, be doing like A plus at work. But then we're tired. And then we have like I said earlier, we know what we need to do,
mhm.
but we just need the reminders. We need someone to continually go, hey, don't forget to drink water.
Mhm.
Like, hey, you've had a whole pot of coffee today, but a coffee is a diuretic. So don't forget to drink water. Like, is that something we don't know? No, we know this, but we need a reminder. And that's why it's important to either have, a group that can hold you accountable, that can give you these reminder tips like you and I both try to do in our groups. Or if you want to dive in deeper, if you have a specific concern, if you want someone to really hear you, like you were saying earlier, then you work one-on-one with someone and you get someone to really pay attention to you, which would be lovely, right? To have something. I mean, you know, if you're thinking, well, this feels selfish or whatever, it's not selfish because you're helping yourself so that you can be in a better place so that you can continue to do what you want to do, which is the dentistry and having a nice life and, all the things that we thought we were going to get when we entered into this profession.
Right. Well, and the beauty of it is like you say, it does spill over into the rest of your life. When I started practicing this, I eventually started feeling better, and I sort of got addicted to feeling better. Like it was just so wonderful to feel good.
Right.
And I showed up to work differently because of that. And then I started bringing some of these practices to work and sharing them with my team. And then we started structuring our days a little different. And patients noticed. The team was happier. I was happier at work. It felt better. It was just like a holistic shift happened.
Right.
And I think that is something that is a ripple that can turn into a wave. You just don't know who you affect with that and what you can teach them that they can teach maybe their teenage daughter who's going through a stressful time,
Right.
or somebody with anxiety that you can help through a difficult procedure, and they can take some of those tips and use them in their life. And
Right.
you just don't know. And so it really is, I think, a gift that just keeps giving.
Absolutely. Yeah. Because when you feel better, that translates into all areas of your life.
Mhm.
And people notice it. I mean, I remember during one part of my burnout getting to the point where I was like, you know, every patient annoyed me. Like even the patients that I really liked and who were really great and who paid on time or whatever. And I'm like, ugh, they're annoying me too. And I was like, okay, this isn't like me. I'm not normally, this annoyed by people, right? So if you're listening to this and you're feeling that, you might want to reach out to Dr. Schwindt and talk to her about it. I know on your website you have a recalibrate your calm with 4 simple breathing techniques. It's a free PDF download that they can get by going to your website. And I know that you have a lot of other great content on there. Your website is lauraschwindt.com. I'm going to put that in the show notes, so it'll be a clickable link for most of you listening or watching. And you can also check out her content on Instagram, Dr. Laura Schwindt. And on Facebook, it's Reclaim Your Balance for female dentists, but it's open to hygienists and all female dental professionals. But guys, if you're listening to this, because I know I have mostly male listeners for the podcast, I want you to know that you are not immune to this stuff. You are not immune. So you might as well follow Dr. Schwindt on her Instagram and get some tips. Go to her website, check things out. And if you have any questions, reach out to her because she is a wealth of knowledge. I love all the content that she puts out. And, just really appreciate you being here and sharing your story and letting people know that there is another way to be in this world.
Yes, thank you so much. And yeah, I welcome anyone that has any questions about this. The breathing, that's one of my favorite, and I know you're big with breathing too. And obviously, yoga is big with breathing, but I didn't realize how little I was breathing when I was at my worst. And it's amazing how just 30 seconds can shift your state. And so it's so simple. It can be done anywhere. No one even really needs to know you're doing it. So
Right.
just such a beautiful, simple thing to implement into your life. Again, simple, not complicated. You just got to do it.
Absolutely. Thank you so much for joining me today. I look forward to hanging out with you online. Friends, thank you for tuning in. If you've liked this episode, please share it with a friend and subscribe so that you can be notified when a new episode airs. Be well, friends.